Did you know that your hands are a perfect example of chirality in the natural world? Yes, you heard it right. Chirality, a term derived from the Greek word for hand, is a property of asymmetry that is fundamental to several branches of science, including chemistry, physics, and biology. Now let's dive into the world of pharmaceuticals. In the realm of drug development, chirality is a game changer. It's all about the orientation of molecules. Just like our left and right hands are mirror images of each other but are not identical. This is exactly how chiral molecules behave. They have the same molecular formula but different three-dimensional structures. Why is this important, you may ask? Well, the orientation of molecules can significantly influence how they interact with our bodies. In the active pharmaceutical ingredient or API industry, chiral drugs are of enormous interest because each enantiomer, that is, each mirror image form of the molecule, can have different pharmacological effects. Consider this. One form of a molecule might be beneficial, acting as a lifesaver, while its mirror image could be completely ineffective or even toxic. This is why the production of single enantiomer drugs is a major focus in the pharmaceutical industry. The concept of chirality is not only fascinating but also crucial in drug development. It helps scientists design safer and more effective medications by understanding how different molecular structures interact with our bodies. So the next time you look at your hands, remember that they're not just tools to interact with the world. They're also a reminder of the complex and fascinating world of chirality that exists at the molecular level. Just as your left hand is not superimposable on your right, so too can molecules exist in mirror image forms with different properties. Consider the case of Propranolol, a beta blocker used to treat high blood pressure. Now, propranolol, like many other pharmaceutical ingredients, is chiral. This means it has two forms, or enantiomers, that are mirror images of each other, the S form and the R form. But here's the twist. These mirror images aren't identical twins. They're more like left and right hands. They look similar, but they're not interchangeable. So, what's the big deal? Well, our bodies are also chiral. The proteins, enzymes, and receptors in our cells are all shaped to interact with specific enantiomers of drugs. It's like a lock and key system where only the right key, or in this case the right enantiomer, will fit the lock. Now, back to propranolol. Both the S and R forms can lower blood pressure, but they do it in slightly different ways. The S form, also known as S-propranolol, is more effective at blocking the receptors in the heart that increase heart rate. On the other hand, the R form is less specific and can interact with other receptors, sometimes leading to side effects. This is where the importance of chirality in drug development and patient treatment comes into play. By using the S form of propranolol, doctors can provide a more targeted treatment for heart conditions, with potentially fewer side effects. It's a clear illustration of how understanding the chirality of drugs can lead to more effective and safer treatments. But remember, it's not just about propranolol. The concept of chirality extends to many other drugs and has far-reaching implications in the pharmaceutical industry. It's a fascinating field where the tiniest molecular differences can have a huge impact on patient health. Thus, the story of propranolol, underscores the critical role of chirality in drug efficacy. It's a tiny twist in the molecular world that can make a world of difference in ours. Now let's delve into the narrative of Metoprolol, another beta blocker with a chiral twist. Metoprolol, a drug belonging to the class of medicines known as beta blockers, is primarily used to treat high blood pressure and chest pain. But what makes it interesting is its chiral nature. Like many substances in the pharmaceutical industry, metoprolol is chiral, meaning it has a mirror image that cannot be superimposed onto the original. This mirror image is referred to as an enantiomer. For metoprolol, we have two enantiomers, R-metoprolol and S-metoprolol. These two forms are almost identical in physical and chemical properties, but they behave differently in a biological context. S-metoprolol is the more potent of the two enantiomers. It binds more effectively to beta-adrenergic receptors in the heart, blocking signals that cause the heart to work harder. This, in turn, reduces blood pressure and alleviates chest pain. On the other hand, R-metoprolol is less active in the body due to its reduced affinity for these receptors. This difference in activity levels between the enantiomers of metoprolol and other chiral drugs can have significant impacts on drug formulation and patient response. For instance, a drug that contains a mixture of S and R forms may not be as effective as a drug that contains only the S form. This is because the less active R form may compete with the S form for receptor binding sites, reducing overall efficacy. Moreover, the presence of the less active or inactive R form may also lead to unwanted side effects in patients. This is why pharmaceutical companies strive to produce drugs that contain only the active enantiomer, a process known as chiral resolution. Metoprolol serves as an excellent example of why chirality matters in the world of pharmaceuticals. The question then arises, how do we separate these mirror image molecules? To answer that, we dive into the fascinating world of asymmetric synthesis and the resolution of racemates. These two processes are the key to separating and producing enantiomerically pure compounds. Let's start with asymmetric synthesis. Imagine you're an artist, and your canvas is the molecular world. In asymmetric synthesis, we're essentially creating an art piece where only one form of the molecule is produced, either the left-handed or right-handed version. But it's not as easy as it sounds. The process requires catalysts that favor the creation of one enantiomer over the other. It's like having a magic brush that only paints in one direction. Now, what if we already have a mixture of left and right-handed molecules, also known as a racemic mixture? That's where the resolution of racemates comes in. It's akin to sorting through a pile of gloves, separating the left-handed ones from the right-handed ones. In a laboratory setting, this is achieved by converting the racemic mixture into a form where the left and right-handed molecules can be separated, often through crystallization. Remember our earlier examples of S-propranolol and S-metoprolol? The development of these drugs was made possible through these very processes. The S-propranolol, for instance, was synthesized through asymmetric synthesis, where the catalyst favored the creation of the S enantiomer. Meanwhile, the S-metoprolol was separated from its mirror image through the resolution of a racemic mixture. These processes might seem complex, and indeed they are, but they are also fascinating. They allow scientists to manipulate the molecular world, creating drugs that are more effective and have fewer side effects. The ability to separate and create these mirror image molecules is a crucial aspect of pharmaceutical development. It's the artistry behind the science. The mastery of this art is what allows us to create the medicines of tomorrow. So, we've journeyed through the fascinating world of chirality in the pharmaceutical industry. As we've seen, chirality plays a crucial role in the development and effectiveness of drugs. It's not just about creating a compound, it's about creating the right version of that compound. The difference between right and left between mirror images can be the difference between a cure and a calamity. We dove deep into the cases of S-propranolol and S-metoprolol, two drugs that highlight the significance of chirality. S-propranolol, a beta blocker used in the treatment of heart diseases, demonstrated how one enantiomer can be therapeutically active while its mirror image can be completely inactive. Similarly, we saw how S-metoprolol, used for treating high blood pressure, showed that sometimes one enantiomer can be more effective or safer than the other. We then ventured into the art of asymmetric synthesis and resolution of racemate. These are the methods used by scientists to separate or create one specific enantiomer from a mixture. It's a process of precision and patience, a dance of molecules that must be choreographed just right. Remember, the goal is always to provide the best possible treatment for patients. And in the world of pharmaceuticals, that often means delving into the microscopic world of chirality. It's a world where mirror images aren't identical, where left and right carry different meanings, and where the smallest change can have the biggest impact. We hope this journey into the world of chirality has been enlightening, and that you now have a greater appreciation for the complexity and importance of this field. It's a conundrum, no doubt, but one that holds the key to more effective and safer medicines. And that's where we'll wrap up for today. Remember, there's always more to learn, more puzzles to solve, and more discoveries waiting just around the corner. The world of chirality is complex, but it's a puzzle that scientists are keen to solve. Subscribe for more because you won't find me later.